At the initial psychology appointment, patients can expect to do an assessment. It's a gentle, supportive session where I get to learn a little bit more about the factors that have led to patients' weight history. I get to understand a little bit more about the factors that may hinder their long-term weight loss outcome. So I do an initial clinical interview. In that interview, I'll be finding out a little bit more about their history, their weight history, their eating behaviors, their psychological history, and then we do some brief questionnaires at the end of that session. The purpose of that assessment session is not diagnostic. We're not diagnosing any difficulty or any psychological difficulty. In that session, we're trying to find out what a patient's individual strengths and weaknesses are so that we can intervene in the long term. The purpose of assessment is always intervention. So we're looking at factors that psychosocial factors, psychological factors that may hinder their long-term outcome. So we're not assessing to exclude them from having surgery. We're assessing to try and assist them achieve what they're setting out to achieve, and that's long-term weight maintenance. I think the wonderful thing about this practice is we're not focused on short-term outcomes. We're focused on that long-term outcome. So that initial assessment is actually to gauge what their individual strengths and weaknesses are so that we can provide a framework, we can provide strategies, we can provide ideas, intervention strategies and plans so that they can achieve that long-term outcome.